platelets, the normal red blood cells, or the normal white blood cells. So in most cases, the signs and symptoms of the disease are usually due to the low levels of the red blood cells. So you find that these people who have got acute myelocytic leukemia, acute myeloid leukemia, often present with shortness of breath because they have low hemoglobin level, and that is why the blood is not able to carry adequate oxygen. They have also reduced white blood cells, the normal white blood cells, because they are producing a lot of abnormal white blood cells. So they suffer severe infections, and most of these people normally get severe infections which are actually life-threatening. They also have a reduced number of platelets in the blood, and you find that most of these people suffer easy bruising. They also suffer from hemorrhages. So this condition is a very bad disease with a poor prognosis, and it is usually of an acute abrupt onset, and it usually leads to death. And personally, I have come across many of my patients who have succumbed to the disease. So it is a very challenging disease. Even its management is not easy, because the chemotherapy which you normally use, where you have to give somebody several courses of very toxic chemotherapy, sometimes they become toxic, and they may also affect the bone marrow, the one you are trying to rescue. You can also maybe attempt
that we cannot explain. So this has shocked us in the medical fraternity, and this one, it will not end here, because it will be a story that will go on and on. It is a long story to tell. This is very shocking.
My name is Margaret Mwihaki Mugo. I'm married and a mother of 3 children. I have 2 girls and 1 boy. The last born is Patience Wajiku. Patience started getting sick around mid-February this year. She started getting fevers that would not go down. So the fever would go down after taking medicine. That is, after taking her to hospital and we are given medicine. The fever would go down, but immediately the medicine is over, the fever would come back. So it's like every week we take her to hospital. February and March and the beginning of April. So when on 3rd of April, when we took her to hospital, Premier Hospital, it's in Kikuyu, the doctor noted there was a worrying trend in the blood components. So he noted that the blood components were reducing. And when someone has an infection, the white blood cells are supposed to be many. So the doctor said the white blood cells were so few, and in fact they had reduced within like 2 months. So he referred us to Nairobi Hospital. But when we came home, we decided we not go to Nairobi Hospital. We decided we would go to Kenyatta National Hospital. So the following day, very early in the morning, we went to Kenyatta National Hospital, and it was taken as an emergency, and therefore Patience was admitted. We were admitted with her because she's a minor, she cannot be alone. So it was on Sunday. So the doctor carried out some tests on her, and one of the tests was the bone marrow test. And on Wednesday, the news were broken to us. She's suffering from leukemia. So it was very devastating. In fact, we were called for a conference. And at the beginning, I was reluctant. But my husband insisted I have to be there. So in the conference room, there were doctors and some nurses and also counselors, meaning the news were not that good. Yeah, so they broke the news to us, and they said she's suffering from leukemia. They informed us that there are 2 types of leukemia. There is the ALL and the AML, depending on the type of the white blood cells that are affected. But at the moment, they said they hadn't established which type of leukemia it was. So the news was so very much devastating. In fact, we cried, both of us, from 11 to 3. And the counselors were all around us trying to comfort us, but anyway, it was so bad. So it was so bad, by the way. Especially on my side, I've never experienced such a thing. It was so bad. In fact, I would not like anyone to go through what I went through. It was very, very bad. So the same day, my husband was given another sample to take to Aga Khan so that they would be able to establish what type of leukemia it was. So on Saturday, again, we were called for another meeting with my husband, and it was bad again. In fact, they informed us that the type of leukemia she is suffering from is the AML, and they told us it is a very aggressive type of leukemia, and it's also a rare type. It affects about 15% of the patients. And they say that, of course, the other type can be managed, but this type, they said it cannot be managed. She has to undergo bone marrow transplant. That is within 3 months because the condition is very much aggressive. Yeah, so, okay. When now the doctor said that she would now be treated using chemotherapy. She said she would start the following week. So on Monday, we agreed. The doctor started the chemotherapy. Okay, she was given from Monday. Then on Tuesday they skipped it. So they would give her and then skip one day for that first week.
Yes.
And then the following week they didn't give her any. So she was supposed to be given the first week, and then they skip the second one, and then they continue the third week. You know, she was crying so much because of the injections. So the doctor suggested that they the situation was so bad. In fact, it was at the worst. I remember the stomach had started swelling. She had the gas mask because the oxygen level was so low. She was so drowsy. And I remember it was the sister who was with her. And together with my neighbor, because she's a nurse. Myself, I was so much emotionally devastated. So I just walked up and down the corridors praying. I was so much worried. In fact, I remember a particular nurse asking me what was wrong with me. So at the moment, I'd left my phone in my bag, so I didn't have my phone. So my sister was trying to call me, but she couldn't get me because the phone was in the bag. But she managed to get my husband. So that's when she informed my husband that a message has been replied from the office of the mightiest prophets of the Lord. And the message said that the mightiest prophets of the Lord are praying for Wajiku. And it is well with her. And they also commanded us to be at peace. When I heard that message, I just got peace. Despite the situation.
Yes.
Yeah, I just had peace. So when my sister called me and told me, I just had a lot of peace. And I knew that God will heal her.
Yeah.
Yeah, because my sister told me when the mightiest prophets of the Lord say something, it is the Holy Spirit. And God does not lie. He's not a human being to speak a lie.
Yes.
So patients would get well. In fact, she told us to go for the test, but inside me I felt if when healing starts, of course I'll see it, because by then she had started bleeding. Okay, she at around 4 she was taken to ICU.
Yes.
9th floor, ward 9. So in that ICU there were no other children. She was the only one. The rest were grown-ups. Yeah, so she was there. She started bleeding from the eyes, from the nose, and also when going for a short and long call, where they should bleed from everywhere. The temperature was also so high. It was 40 plus. Yeah, the blood pressure was also down. The doctor told us that she was holding the BP on medicine. In fact, the nurse here, our neighbor here, told us later that that's a polite way of telling us to get ready for. She can die anytime. Yeah, so you were called for another conference. My sister was present, and she talked about the mightiest prophets of the Lord, and she said that people are getting healed, and she talked about Winibet, who didn't have a uterus, but she got a baby boy, and she told the doctors that when healing takes place, she requested them to join us in the celebration, and they agreed. But the doctors told us that at the moment, by then, they told us that they were using the strongest antibiotics available. So beyond that, they have no other help. So it's like they were preparing us for the worst. And they were also requesting us that if she gets worse, wamweke kwa machine. Yeah, so she was at a very bad situation. Yeah. So the blood pressure was also down, and it was holding on medicine.
Yes.
Yeah. The respiration was also not good. It was, all the vitals. Yeah. So she was in a very bad condition. So I remember a day before my sister left to Nyahururu. Patients put her finger in the nose. And she said bleeding has stopped. So from there, inside me, I knew now healing has started. Then after some days, the doctor said that patient is doing well. The blood, they now withdraw the medicine that is sustaining the blood pressure, and see how she will react. So in fact, when they removed, the blood pressure came back to normal, and within some days, patient was discharged from the ICU back to the general ward. And by the time she was being discharged, the bleeding had stopped from the nose, the eyes had cleared kabisa, the temperatures were down, were normal. I don't know, by the okay. Now, when she was discharged back to the general ward, and in fact, after 2 days, it cleared. Yeah, from the urine, yeah, and the feces, there was no blood. And then another thing, the doctor was not referring to us about the blood count. They had taken a blood count just before she got out of the ICU, and they took another one when we went back to the general ward. But the doctor did not tell us about it. She just told us that now she can discharge us for some few days. And I wondered why, because before she was insisting that patients cannot come back home because of the low white blood cells, because of the infections. So she didn't tell us how the blood count was. Now, when we were discharged, the day that we were being discharged, when we came back home, we read through the discharge summary. And in fact, we didn't realize that the blood components were within the normal range. The nurse, now our neighbor, when she went back to being so good. After midterm, she went to school. She went for about 6 weeks, and then they closed last week. But yeah, So her health has been good.
Has been perfect.
Yeah, perfect.
Amen.
Yeah.
Amen. We really celebrate.
She is very, very, very active. In fact, in the morning when she's eating, she requests that we play hide and seek. So we keep on playing here in the house.
Yeah.
Yeah.
Amen.
Early in the morning before she goes to school.
Yeah.